Fayette County is seeing double the cases of pertussis right now that we've had in the last 5 years. WKYT's Alyssa Williams spoke with the health department and pediatricians. She has more on the demographic this illness is hitting the hardest right now.
In the last 8 weeks, the Lexington-Fayette County Health Department has seen an outbreak in pertussis, also known as whooping cough, across the county. But what's surprising is who this outbreak is primarily impacting.
The health department's spokesperson Kevin Hall says while this illness can be deadly for babies or those with underlying health conditions, high school age kids are making up the majority of the 32 cases they're seeing right now.
The vaccine is part of regular childhood immunizations with a booster at age 11. It is required for school-age children in Kentucky. But you think about that, you get the booster at age 11 and it weakens over time.
Pediatrician Dr. Katrina Hood says the outbreak began while these kids were still in school in April and May.
Now that kids are out for summer, they're probably not spreading it as much as they were in the classroom, but there's some things about this bacteria that are important to know as far as exposure and those sort of things that bring this about in patients.
Pertussis can sometimes present itself as cold or allergy symptoms, but if they continue for several weeks, it's important to go to the doctor.
We do know that the vaccine does provide protection. You just need to make sure that you're updated on your booster. So if it's been 5 to 7 years since you've received that booster, make sure you talk to your provider to see if it's needed.
In Lexington, Alyssa Williams, WKYT.
Hall says the spread of whooping cough can also be prevented through frequent hand washing. He adds it's important to get the booster, especially if anyone close to you is pregnant or if you are around babies.